Hello everybody, I'm Dr. Joe from South Korea. I'm here as an observership, and I'm here for observe the Professor Kwan's and also many the fellowship and many residency also. Today is tomorrow is my last day, so I prepared some interview who work in the with the MGH, who work with Professor Kwon in MGH as a fellowship. I'll introduce her. She's name is Lauren, and she's a graduate medical school, University of Miami, and the orthopedic residency in Texas University and medical branch, and she is now in Harvard MGH Hospital, a foot and ankle fellowship. She looks so nice, and she is so, she is so beautiful, and she is so kind person. Have I ever been in my life? So in actually, that is a totally different culture. What I make this video is the culture of the Korea and America is so totally different, especially in life in doctor, orthopedic surgeon is so totally different. That's why that is the reason why I make this record. It can be helpful to get entrance medical school in Korea or America also. So I hope to great interview to with her. I hope that. So, hello, Laura.
Hello.
Nice to meet you.
Very nice to meet you. Thank you for having me.
Yeah, I prepared some question. If you don't mind, you can talk to me very easily. Yeah. So, how do you become a medical student in Harvard? How do you get entrance to the medical student at Harvard?
The easiest way to answer that is that it's a very long road, but there are many ways to get there. So rest assured that there are a number of things that you can do. The easiest way to get into medical school, especially if you're reaching for Harvard, is to start early. Even starting from high school in some cases, just identifying that interest to be a doctor can really help you make sure that you're successful in your goals. So what we often say the typical medical student has done is in undergraduate level, so in college, they're taking pre-medical classes, they're making sure that they're getting very good grades. Straight A's is usually something that we talk about, being quite helpful to get into medical school, but also doing things outside of academics, so reaching out to mentors within medicine already, and so identifying their interests early, making sure that they're doing medically related research so that they are getting their name out there, basically. And then also just making sure that they know what exactly they want to do in medicine.
Yes, you mean you have to grade in high school student, high school, middle school student, and also you have to prepare some research with to be a medical student with somebody, some professor. You have to prepare some research. Is that correct?
There are a lot of, we call them prerequisites, almost to get into medical school and also into residency. So a lot of those things make it a lot easier. One of the things that you have to do is called the MCAT. It's been a while since I've taken it, so I don't remember what it stands for. But it's one of our standardized exams that helps compare applicants to each other. And so it's a big test for us, where that score determines what sort of interviews you get and if you're able to actually get into medical school.
Yes, actually in Korea, to be a doctor is we have some big tests. Every high school student have to test in one year after graduating high school that called sunon in Korea, like it's similar to the SAT in America. So we have the we could get entrance to the medical school directly without graduate another college. So just after graduate high school, we can get entrance medical school directly with just some test. What that is the biggest test in Korea, and the second option is to prepare like you. So we have to good grade in the high school every test. That's called the daeshin. We have to achieve every good grade each test. So there's so competitive. So we are to be a doctor is so competition. So we have to try so hard every day. So many high school students get so stressful because of So that's a little bit totally different of your country, of America and Korea.
Sounds like you have to know very early on.
Yeah, right. That's correct. Yeah, we changed the. We actually few years before we take rules like you after graduate some college and to another. After that, we can go to another medical school. That was the renewed rules of the government, but that is a little bit some issue of the equivalent is not it's different. There is some issue that that test could take a rich guy and the poor guy, or many rich person can take their equal
The resources they have are different.
equalization. Is that correct expression?
Equality.
Equality. Okay. So there is some issue in case of the equality. Yeah. So we government we have to get back to the before our before the program to be a doctor is now, as I said, to after graduate high school and go to directly medical school is our rules. Yeah, thank you. And second question is how long does it take to graduate medical school?
It's a long road, that's for sure. It's different for different people. So the standard, I guess, length of time that it takes to get into medical school is once you graduate from high school, you end up doing a normal 4 years of undergraduate or college training. And then from that point, you're able to get into medical school, which is 4 years for us. However, some people we call them non-traditional applicants. They end up going through high school, going through college, finding a job that's outside of medicine or perhaps related to medicine, but then deciding later in on life that they want to become a doctor. And so where they typically have to do is they end up going back to take certain scientific classes or courses so that they have the prerequisites in order to go to medical school, and they still have to take the same exam, that MCAT. And so it's a little bit tougher because you're outside of school, you're no longer studying the sciences and things like that. One of the people who was in my medical class actually was 40 years old. So there's no age limit, which is a good thing, but everyone's path is a little bit different in terms of how long it takes for them to finally become a doctor.
Yeah. So in case of Korea, we have usually we graduate. We have time of the graduate as a medical school is around 6 years, and after that we participate in internship and the residency each 1 year and 4 years. So to be a doctor or special doctor in Korea. To be a special doctor, it takes around 11 years. A little bit different. Third question is how difficult to get into the Harvard Medical School?
Very. The most important thing to make sure that you are successful is your grades. And so having A's, we have what we call a grade point average here. So the average or summation of all of the grades that you've gotten within your undergraduate training. They even look at high school sometimes, but having above a certain GPA becomes very important in terms of making sure that you get interviews, because some places have a cutoff in terms of they see that your score is below a certain point and they say, nope, can't interview them, we won't accept them into our school. I don't know the magic number these days, but typically having a GPA of about 3.7, 3.8 or higher is very desirable, which means all A's, all A pluses, maybe a few A minuses, maybe one B. But it's very hard to get by on that. But nowadays, I think that culture is changing. So not only are grades important now, but having extracurriculars is something that they look at, which I encourage, and I'm very much a proponent of having someone who's more well-rounded, who will be able to speak to patients, be a kind person, and be able to relate with them. And so people who are doing sports or people who are doing more research that counts as an extracurricular, or even people who play a musical instrument or in a band of some sort, having that diversity in life experiences is now something that medical schools are really looking for in a candidate or an applicant for medical school. But on top of that, another important thing to have, I think I mentioned this previously, is just mentorship. So identifying someone who is already in the medical field, who is able to give you advice about how to get into medical school, how to make yourself a desirable applicant, is easily one of the best things to have moving forward with that path.
Great. So it's so difficult, like in Korea also. So we actually in Korea the school and grade is the most important thing nowadays. But we have to be changed like America. That is a much more better way to get entrance, permit every students to the medical schools. So I think that is a more reasonable way. The first question is how about typical lifestyle as a doctor in America?
Everyone's, I guess, life looks a little bit different. Depends on what exactly you want to accomplish as a doctor. And so some people continue to have kind of a hard-working lifestyle. That's a good way to put it. I don't want to say stressful per se, but it does come with extra stress. Looking at taking care of patients in academic settings, so in the hospital, where they come in every day, they take care of sick patients. They're on call during the night, so they may end up having to come into the hospital again and work for long hours during the night and even the weekends as well. Whereas some people will take more of a relaxed approach, and so they become a doctor, and they say, hey, I want to help people, because we all want to help people in the end, but I don't want to help people 24/7. I want some control in my life as well. And so those are people who more work in clinic settings, or we call them ambulatory surgical settings if you're a surgeon. And so having more of that 9 to 5, it might be more accurate to say 6 to 5 lifestyle, but at least having some more control about your social life and what you can do after work, and not having commitments outside of your hourly work.
Yes, I totally agree with you. So when I talk about this topic with Professor Kwan. He also talk like you, so he also think the right quality is also important to a doctor as a doctor. So as in his residency, he didn't he sleep well better than us. So actually in Korea to be orthopedic residency or as like as a residency in orthopedic, it is too hard to sleep well because we have to do a lot of work actually. So that is a problem, and the second problem is our the senior to junior are so totally different, as a social. That means the senior just talk like not like equally senior to talk to the junior. So different. We have to pay junior have to pay to the senior. That is the a little bit Asian culture. So
like a hierarchy almost.
Yeah,
where
right.
the seniors are more in control and the juniors have
Absolutely.
to do what they're told.
That's what I'm most impressive in things in the MGH hospital actually, because professor, it seems like to me Professor Kwan and Lauren and another resident look so similar, not look so equal. Yeah, it feels like that. So they talk to about the patient, and they talked about operation discussion, and they totally. I know that professor teach to the fellows and some residents. I know that, but he always trapped by himself, and he cleaned the trash by himself. It's so totally different culture. As Korea is so different. So I'm very impressive about that. So that is the next step. What we have to be changed in Korea. Also, I think.
We've come a long way for sure. We used to be more like that in terms of the hierarchical system, but over the recent years, things have started to change. Where we value teamwork amongst the different levels a lot more, and I think that change has been very positive.
Right, that's cool. I think that can make a much more creative idea. If I'm a senior, if I talk to my junior, hey, you have to obey my talk. That is, if I just treat like that every time, the junior cannot go faster, and they cannot overwhelming my ideas. They have to overwhelming some seniors, and they have to grow much more than before. I hope so. That the best way to be like, I think the best way to be like creative doctor or creative surgeon is make it feel calm and feel equally comfortable.
Open environment.
That is open discussion is the most important thing, I think. Thank you. Yeah, and my fifth question is your quality of life and work-life balance, and how about that?
It's supposed to get better as the years go on,
Yeah.
but it's definitely a difficult road, especially if you want to be successful and end up at a prestigious institution, I guess you could say. It's a lot of hours of work. Recently, at least on the residency level, they've come up with a new rule where there is now a cutoff in the number of hours that we can work. So I don't know if you've heard about the 80-hour work week that they've now instituted in residency programs as a mandatory. And so before that, you can even probably talk to Dr. Kwan about this, but that didn't exist. So people would be working easily 120 hours a week, and that was just expected. That wasn't something that you could complain about. And so, as you can imagine, there are only so many hours in a day, and you don't have the time to do things outside of work or even sleep. It's just part of the training process. And so now that we've kind of cut back in terms of the work hours, we have more time to do things we enjoy outside of work, which I think is important in terms of making sure that you're a well-balanced individual. And medicine isn't the only thing that you have to do every day.
Yeah.
But an argument to that is, are we getting the same amount of training? Are we prepared enough once we are finally done with our training compared to those before us who had those 120 hours a week that they were doing? And that I think is an interesting discussion for perhaps another time.
Yeah.
But other than that, throughout the year, we typically take vacation maybe allowably 3-4 weeks out of the year, depending on where you're at. And also depending on where you're at, it's encouraged in some instances to take less vacation, whereas others are more open to saying, hey, like, take the time off, you deserve it, this is what you're owed.
Yeah.
And so maybe on average, at least during the training years, no more than 2 weeks out of the year are true vacation time.
Oh, it's a little bit similar in Korea. We have one week in holiday. We have the 1 week holiday in summertime and another 1 week holiday in winter. So 2 weeks. That is all our holiday in residency and fellowship.
That's intense.
Yeah. What did you say? You're much more than 2 weeks?
In some instances, there are 3 or 4, but what I have experienced before this point in terms of fellowship has been 2 weeks is the normal amount that you are behind the scenes allowed to take. On paper, you can take more, but usually
2 weeks.
Yes.
2 weeks per 1 year.
Yes.
Oh, same. And I'm actually when I was have so top schedule when I in the residency or fellowship. The schedule was totally top, so hard. So when I graduate the fellowship, I can take some my vacation time and holiday time. So my best hobby, my favorite hobby is the bicycle riding bicycle. So I go to the mountain. Yes. How about you? What kind of the hobby do you have?
What hobbies did I used to have? No, I'm just kidding. So I was a big swimmer back in the day.
Oh, really? Swimmer. Wow, great.
So I did that all the way through grade school into college. That was my thing. I grew up in the island, so full disclosure there.
You know, it's in Miami. There's many beautiful beaches, so
yes,
that's the impressive.
Yes.
Right. So I envy you. Your life is totally different. My sixth question is a little bit sensitive for you, but how much is your salary? How much money for your salary as a resident and fellow, and after graduate fellowship?
So it depends on which state you are in the United States specifically, because based off of kind of the average living or cost of living, I should say, your salary is based off of that. So for instance, I went to residency in Texas, and so Texas has a very low cost of living there, and so our salary reflected that, and specifically I made between $50,000 to $60,000 a year as a residency there. It increases every single year, kind of as an incentive, like you're becoming more senior, you're getting more pay for your work. However, if I had done my residency in New York, for instance, it's very expensive to live in New York, as you can imagine. And so their salary is higher to help help them live, basically.
Yeah,
And so
they have
I would
to.
imagine it'd be within the 70,000 to 80,000 range. Looking at the salary here, at least in Boston, it's within the high 70s to high 80s range. But now they're starting to increase it every year, so it will be around 90,000 as a fellow, I want to say, each year. And so fellowship is treated as another year of residency, and so there's not a big jump in terms of the salary from finishing residency compared to fellowship. It's a few $1,000s additional that they add on to that. It just becomes, so for orthopedic surgery, 5 years of residency, it's PGY6 or residency year number 6 pay that we get as a fellow in orthopedic surgery.
Okay.
As an attending, that's when things change.
Yeah.
And so depending on what you want to do, whether it be more hospital based, so academics and kind of making sure that you're staying within the hospital system, versus private practice where you are more production based. Not based off of the hospital. So academic clinicians or surgeons get paid less comparatively compared to private practice, where they have a little more control over their schedules, and it's, like I said, it's more based on productivity. Each specialty within medicine is a little bit different in terms of how much they're compensated, and even within each specialty, each subspecialty is compensated a little bit differently based on what they do. And so speaking about primary care in general, so family medicine, internal medicine, pediatrics, those sort of things, I only roughly know the numbers around those. Once you come out of fellowship or just residency in general, if you didn't do a fellowship, I think those entrance numbers are around 150,000 to maybe 200,000, and then a little bit higher if you do private practice. For orthopedic surgery specifically, as a foot and ankle surgeon, going into academic practice most likely, the number that I've been told is average is around 300,000 to 350,000. But if you go into private practice, that changes, and so that number can easily be within 500,000 to 700,000. If I had done spine surgery within orthopedic surgery, that starting number, so instead of the 300 to 350,000, easily becomes 500,000 to 600,000 within academics, versus private practice again gets higher. It also depends on where there's need as well in the United States. So underserved parts of America, at least, they end up wanting to, or needing to, I should say, recruit physicians to come and work there. And so I've seen at least emails, about starting salaries of up to $1 million US dollars.
Is that include the tax-free?
No.
Without tax.
That's how they get to you.
Without tax. Okay, great. So in average, the Korea orthopedic surgeon salary is around 200. Yes, but some when I said that the experience more skillful surgeon have a little bit much more, but the average of the salary is around 200 maybe. Yeah, right. So the seventh question is what is your next step after fellowship? What is your dream?
Finding a job.
Yeah.
Sure. And so it's becoming a little bit more surreal as the months pass by, and I realize I'm finally getting to those final steps in my career. I want to stay within academics. I believe in terms of the mentorship and having the open kind of relationship and contact with medical students, with residents, with fellows is very important, and I want to continue that. And so looking at various hospitals and trying to stay within that system that allows me to do that is more important to me than having a lot of patients that I see and that surgeries that I do, and thus having higher productivity and hopefully higher salary based off of that. So we'll see. I'm still looking.
I totally expect you are successful as you.
Thank you.
Yeah, totally. I'm sure about that. You are such a good doctor, and you have. Sometimes later you will be most skillful and most famous doctor someday.
Oh gosh, we'll see about
I'm
that.
sure about that, yeah.
I'll be happy with just the skillful.
Yeah. My last question is: are you feel proud of to be a doctor, orthopedic surgeon in America?
I do. That's the simplest way to answer that. It's definitely been a long road, I would say. A lot of hardships along the way that you can expect to have just pursuing medicine in general, pursuing orthopedic surgery in general, and then on top of that, pursuing orthopedic surgery as a minority within the field. As you saw from our talk, we faced different hardships as well. But through and through, I'm happy with everything that I've done, and I'm looking forward to the future.
Great. Yeah. I have another additional question.
Okay.
How is your secret? How can you maintain your great smile? You always smile and you always make comfortable on others, and that is the very because of the life of doctor is so stressful, but you beat the stress and you always smile, keeps on others also. So how can you do that?
Well, thinking about that, part of my personality is just to be optimistic in general and kind to others. But really, despite all of the difficulties or troubles that I've had in my life, or when I'm having a particularly hard time and I'm like, oh man, like today really sucked, or I could have done X, Y, Z better. I think about others and those around me and how they see me and how they perceive me. And I don't want people to think of me as a negative person. I want them to look up to me as a role model. We are all role models within medicine, so it's very important to portray yourself as that, because people look up to you and they want to emulate you or model you. And so in my mind, I'm always thinking, hey, someone else has it worse than me, and for that I'm grateful that I'm where I'm at today.
Great saying that. I respect about your thinking. Yeah, that is so impressive for me. But also, so you are so life of doctor is so pretty stressful and pretty tough. But the way you to maintain your optimistic and your positive thinking is that you have to try to be a better. Good to others. That is to try, and your personality is so wonderful, I think. Yeah. Thank you for my interview, and I hope this interview could have somebody who want to be a doctor or medical and to get entrance to medical school.
I hope so as well.
Yeah. Thank you. Could you say hello to my subscribers? Thank you.
Thank you for having me. I appreciate it.
Thank you, Lauren. I appreciate that so great interview. Thank you so much. Yeah.